Okay, I think we'll just make a start, and I'll Neil, if you can maybe just admit people as we go along, if anyone else joins. So hello and welcome to everyone. Thank you again for joining us. If everyone can mute themselves, I think there's a dog barking already. Welcome.
That's mine in the background. Unmute yourself.
So this session is evaluating the effects of basic income, evidence from studies of similar interventions. My name is Jack. I'll be the host of this session and any discussions and questions which may follow afterwards. I'm one of the volunteers that's helping with Basic Income Earth Network World Congress, which is being hosted by Glasgow. And I'm also the secretary on the board of trustees at Basic Income Network Scotland. I also recently completed a master's in political communication, in which I investigated how online policy advocacy targets the policymaking process using the basic income movement as a case study. So I'm really interested in the theme of this Congress, from taking basic income from idea to reality. I'm joined by another volunteer, Neil Brown, who will be moderating and keeping things moving in the chat. And before we start, I'd just also like to go through a bit of housekeeping. So please make sure that you're on mute unless you're invited to speak. This ensures that we're not cutting across our speakers or causing any issues for people who are hard of hearing, who depend on the live captions, which you should see along the bottom there. When you are talking, please speak slowly and clearly so that the captions can pick up exactly what we're saying. The last portion of the session will be a discussion. Please put your questions in the questions and answers box on Hoover throughout the session so that we have lots to come back to. You can upvote questions you want to see posed to our speakers, so please do that as well. We should have about 20 to 30 minutes for discussion at the end, but that's never enough, so do use the chat feature throughout as well. We're encouraging attendees to use the chat feature on Hoover as opposed to Zoom, and we have disabled the chat on this Zoom call, so please use the chat on Hoover if you can. You can also private message people through Hoover if you want to talk more about something. We have a roundup session today from 6:30 to 8 p.m. British time, where there will also be even more time for discussion, so please join that as well if you can. If you have something specific that you need for this session to be more accessible, please let us know. You can either unmute yourself and let us know just now, or you can put a note, a private message in the chat to myself or Neil, and we'll try and help you out as much as possible. Just before we hand over to our speaker for the session, I want to remind you all that the mission of this Congress is to bring speakers and attendees from all over the world together to take basic income from idea to reality. And in this session, we have Dr. Marcia Gibson with us, who will do this by synthesizing the findings of two studies on how we can evaluate the effects of basic income by looking at evidence from similar interventions. So without further ado, I'm delighted to hand over to our speaker for this session.
Hi, thank you, Scott. Thanks everybody for coming. Hope you find my talk today interesting and stimulating. I just want to start off by saying that I'm aware that the Congress is intended to be a very accessible event. So I have not used I've done my best to avoid technical language in this and to try to explain some concepts around study design and what have you without getting too technical. I'm also probably covering some ground that a lot of you are very familiar with. So forgive me if it's a bit dull for any of you, but as I said, I just wanted to try and make sure that it is accessible as possible. So I'm sure many of you were at the plenary session on the work of the Scottish Feasibility Group, and Wendy Harty mentioned at the end that this systematic review or systematic scoping review of evidence from studies of basic income was conducted in conjunction and collaboration with the feasibility group to try to draw together the available evidence on basic income from other high and upper middle income countries around the world. I'm just going to swap to my slides now. Try to swap to my slides. Right. Sorry. So yeah, as I said, the Scottish Feasibility Group had explored possibilities for a Scottish basic income pilot, and it was identified quite early in the process that a review of the available evidence was needed to support the work of the feasibility group. Particularly, the Scottish Government had identified a need for an objective and comprehensive overview of the evidence. Now, the evidence has been summarised quite a few times in the past, but it hadn't been done necessarily in a systematic way. And existing summaries tended to be produced by people who were either very strongly in favour or very strongly against basic income, and then tended to conclude in, obviously, support of their own viewpoint that it would either be extremely successful or a total disaster. So there was a need for evidence from sources with no particular allegiance to either side of the debate. As it happened, I had already started a systematic scoping review of the evidence on basic income. So we decided that to fulfil the need for objective evidence and to feed into the feasibility study, I would work with Wendy Harty of the feasibility group on the review. Now, interestingly, I've seen that a lot of people are already asking, well, why do we need to evaluate? So I'm going to discuss some of that just now. Obviously, everybody here is very well aware that basic income has become increasingly popular as a policy idea in the last few years, partially as a response to increasing inequality and job insecurity. It's very controversial, however, as we all know, and much of the controversy hinges on different predictions about the effects a basic income would have. In addition to objecting on grounds of cost, opponents argue that people would work less and become dependent on the state. Supporters believe that this wouldn't happen, or if it did, it would be because people were able to choose to do other productive things like caring for relatives, starting businesses, or returning to education. Supporters also argue that it would reduce poverty, leading to improvements in health and increase equality because everybody receives the same payments. And people on both sides are very confident that their predictions are accurate. So obviously, as we all know, one approach to investigating whether any of these predictions are correct is to conduct pilots of basic income and try to measure what effects it has. However, particularly with basic income, this is an extremely challenging thing to do. As we've also heard about some of the challenges that the Scottish Feasibility Group faced when they were trying to develop their proposals for a pilot in Scotland. But it's actually very difficult to be sure that any new or reformed policy has had the desired effect. Often policies are implemented because it seems obvious that they will have a particular effect, but when they're robustly evaluated, it turns out that they don't after all. A couple of examples I have got to help to illustrate this point. Scared Straight was a program in the States that was intended to reduce teenage crime. Young offenders were taken to adult prisons and introduced to prisoners to demonstrate the negative effects of offending. It was widely believed that this would be so frightening to the young people that they would stop committing crime or reduce their offending. And there was even a 1978 Academy Award-winning documentary which claimed that Scared Straight was highly effective. When the programme was evaluated by comparing a group of young people who were taken to prisons with a group who weren't, they discovered that actually the opposite effect was the case. Crime was much higher in the prison visitors. Nobody's quite sure why, but one theory is that far from putting young people off crime, exposure to more experienced criminals actually encouraged criminal activity. Another example is infant simulators, otherwise known as robot babies. These have been used as an attempt to reduce teenage pregnancy since 1993. Teenage girls are given a realistic baby doll which cries, needs its head supported, and wakes up in the night, and they're expected to take it with them everywhere they go for a week. And it was believed that this would make them understand how difficult it is to care for an infant and put them off having their own baby. But again, when the girls who were given babies were compared to a group of girls who didn't receive babies, it was found that the effect was the opposite. By the age of 20, girls who were given a robot baby were more likely to have given birth or had an abortion than those who weren't. Again, no one is quite sure why, but it's thought that the young girls got a lot of attention when they had the babies, which they actually found quite enjoyable. Despite this evidence, the programme continues to be delivered in 35 countries, with individual robot babies selling for up to £1,600 in the UK. So policy changes don't always have the expected or desired effects, and there can often be unintended consequences. Basic income in particular is a highly complex system-level intervention that could have very unpredictable effects. It's extremely challenging to design a study which would evaluate basic income effectively. By considering the main features of a basic income, we can see why it is so hard to evaluate. A full basic income would be universal, permanent, unconditional, cover subsistence level, and the value of payments wouldn't change in relation to earned income or income from any other source. It would obviously have to be universal in order to deliver the objective of providing an equal baseline income to all citizens. The effects of giving money to people who are already financially comfortable could be different from payments that are targeted to specific groups. There is evidence on the effects of many forms of income support and social security around the world, but the vast majority of these are targeted at people with specific needs, such as being unemployed or on a low income, or homeless, or having health issues. It's also possible that there would be different effects if everyone received payments, because effects on some outcomes could spill over into other areas. For instance, if a basic income reduced stress, this could lead to reductions in mental health problems and crime, which could then lead to cost savings for services like health and policing. Or a basic income could lead to an increase in consumption, which could increase the number of jobs available. This could in turn force employers to increase wages, which would then have unpredictable economic effects at the macro level. Most evidence is from studies where payments are made to a sample of people who are scattered across a large area, so these effects can't be measured. Because there are very few schemes that provide cash payments to the population of an entire country, there's very little evidence on these kinds of spillover or macroeconomic effects. Measuring many of these effects requires that payments are made to a large sample of people living in the same area. If the area is not representative of the rest of the country, then the findings might not be representative of what would happen if everyone in the country received payments. You also need then to identify a comparison area which is sufficiently similar to the area where people do receive payments. And even then, an area level study like this wouldn't provide evidence on different effects that could occur if the population of a whole country received basic income. It doesn't tend to be included in definitions of basic income, perhaps because it's kind of obvious, but a basic income would be intended to be permanent, wouldn't achieve any of the aims in terms of stability or security. It wasn't. Again, it's very likely that the effects of a permanent basic income would be different from those of temporary payments. People might be less likely to change the amount of paid work they do if they knew that payments would stop in 2 or 3 years. They might not choose to start a long college course if the money was going to stop before the end. Effects on health and other outcomes might be stronger if people weren't worried about payments coming to an end. And also effects on these types of outcomes typically take quite a long time to change. Obviously, pilots tend to be quite short, 2 to 3 years, or sometimes 5 at the most. So they don't provide evidence on a basic income as it would be implemented. There are very few permanent programs that pay money to everybody in a nation, again. Perhaps the fundamental feature of a full basic income is that it would be unconditional, with no requirements to seek or be available for work and no behavioural conditions of any other kind. Unless payments are unconditional, they won't provide the freedom to pursue activities other than paid employment. Studies of unconditional payments are required to provide evidence on whether people would work less or how it would affect people with work activities and other activities. But there are a limited number of schemes that have paid people money with no conditions attached in high-income countries. If it was funded by income, excuse me, I think I've jumped a page. In order to provide security, a basic income would need to be fixed in value and not withdrawn or reduced due to income from any other source. To truly give people freedom to choose how they spend their time, it would also have to cover at least basic subsistence needs. Effects on employment would probably be different if the basic income could be withdrawn or didn't cover basic living expenses. Effects on stability, security, and employment would also be likely to influence the effects on health and other outcomes. The source of funding is another important feature that could alter the effects of a national level basic income. Obviously, there's quite a number of different ideas for ways to fund basic income, including new taxes on resources, on social media companies or on carbon emissions, printing the money, or through the current income tax system. If it was funded by income tax, it would require large increases in the amount of tax that people pay, particularly higher earners. The Scottish Feasibility Group funded a modelling study which showed that a basic income at the level of current out-of-work benefits, which is very low, would require increases of 5 to 8% across the tax bands. People on higher incomes had to pay a lot more tax on any extra income they earned. It could change their decisions about how much paid work they did. Effects on productivity and the wider economy would also be different from a pilot where the payments were funded by the study and people's tax rates didn't change. So, to get evidence on the effects of a basic income, we need studies of payments that are permanent, paid universally or at least to large populations, paid unconditionally, cover subsistence level, and don't fluctuate. Even if they met all of these conditions, to truly replicate basic income, they would need to be funded in a similar way to any basic income that was actually implemented. By definition, a pilot study is short-term, and the vast majority of studies are of payments that are made to small dispersed samples and or targeted at particular groups of people. Essentially, no study meets all of these criteria, so we do not currently have evidence on the effects of a basic income as it would actually be implemented in reality. Most of the pilots currently underway meet very few of the criteria for a basic income. The Finnish pilot was targeted at a scattered sample of unemployed people. The payments were below subsistence level, and most of the recipients still had to meet work-related conditions. The Stockton pilot sample was very small, and payments of $500 per month to only one household member were well short of subsistence. And this is the case with many of the current US pilots. Large area level studies are very expensive to conduct, and the Scottish experience has shown that even when there is a desire and potentially funding to conduct a pilot, political barriers can prevent it from happening. However, this doesn't mean that there's no useful evidence at all. There are studies of pilot schemes and of national level policies which meet some of these criteria and can shed some light on people, particularly on how people respond to unconditional cash payments. There are also other approaches to evaluation that could overcome some of these issues and barriers. So as I said, working with Wendy Harty and also with my colleague, Peter Craig, I led a systematic scoping review of the evidence from studies that are similar to basic income. A scoping review is a way of trying to find all of the studies on a topic, systematically extracting the evidence from them and presenting it as objectively as possible. It allows us to consider the body of evidence as a whole, including whether findings are consistent across studies, and whether differences in context or the design of the basic income might cause any differences in the effects. It also means that we can identify any gaps in the existing evidence. So in the review, we included studies of cash payments to households or individuals in upper middle or high income countries. Payments had to be unconditional and meet at least one of the other criteria: universal, permanent, subsistence level, or not affected by other income. The studies had to compare effects between groups who received payments and those who didn't, both before and after starting to receive payments. We also included studies where a small sample of people were interviewed in depth about their experiences. We found 27 studies of 9 basic income-like pilots and policies. The review was published in 2020. And quite a lot of new studies have been published since then, but we haven't conducted new searches or systematically extracted the data from them. The total we know of is now 44 studies from 11 pilots and policies. Most of the studies have strong designs that allow us to be quite confident any changes were caused by the payments, or they use in-depth interviews to get a deeper understanding of how receiving payments affects people. So I'm going to present an overview of the findings from the original set of studies and the new ones, bearing in mind that, as I said, the new studies haven't been through a sort of systematic review process. This is just the ones that I have found serendipitously or looked for since the last review. So the negative income tax studies were 5 large studies of a basic income-like program that were conducted in the United States and Canada in the 1970s. NIT provided income top-ups to low-income families, which were unconditional and covered subsistence, but they were withdrawn gradually if families earned money. The samples were geographically dispersed, except for the Dauphin site in the Canadian income study, where everyone who earned below a certain level was eligible for payments. Studies ran for 3 to 5 years. So NIT met the criteria of unconditionality and meeting subsistence, but not universality, permanence, or payments remaining of the same value. The Dauphin site could be seen as quasi-universal because not everybody received payments, but anybody who needed them could during the course of the study. And this allows us to investigate community level effects to some extent. A lot of the data from the Canadian study weren't analysed until quite recently. In addition, researchers are continuing to reanalyze NIT data that were analysed at the time, and often the results completely contradict the original conclusions. The Alaska Permanent Fund has invested the profits from the Alaskan oil industry and distributed the dividends to all Alaskan citizens since 1982. Since the dividends vary from year to year, the payments fluctuate in value. They're not affected by other income, but they are well below subsistence. However, they're still substantial at a household level, accounting for up to 20% of the household income of low-income Alaskans. So the APF is unconditional, effectively permanent, although that is, I realise, in doubt slightly at the moment, and truly universal. However, the payments don't cover subsistence and they vary from year to year. They're also received as a large annual lump sum, which is not how a basic income would work in practice. Despite this, APF is probably the closest thing to a functioning basic income there has ever been, except for the quite major caveat that it's not funded by taxation. Researchers have used innovative study designs to compare many outcomes in Alaska with other US states. So there's actually a lot of really interesting evidence from there. Because it's paid to the whole population, and there are robust data available for many outcomes, APF can provide evidence on spillover and macro level effects. The Iranian government abolished generous subsidies on fuel and food in 2010. To compensate for this, they implemented unconditional monthly payments to all Iranian households at the same time. These were approximately $40 per person. At the time, the government said that the scheme was going to be permanent. And it was higher than subsistence level for low-income Iranians. However, the value soon decreased due to rapid increases in inflation. It was funded by very high government borrowing, which contributed to destabilizing the economy. And very soon there was pressure to target payments at people on low incomes. I've actually struggled to find any information on whether any of these reforms have actually been implemented. I'm not quite sure about the current situation. But the payments are or were universal, unconditional, and fixed in value. They briefly covered subsistence and they were described as permanent, but it seems that few Iranian citizens actually believed that that would be the case. So that may have altered their responses to the payments. The funding mechanism was borrowing, which had negative macroeconomic effects. It was very similar to full basic income in the early stages. The loss in value and announcement that payments would soon be targeted quickly changed that. The Native American casino dividends. Some Native American nations started running casinos in the mid-1990s. In many nations, a portion of the revenues is distributed to all tribal members, usually in lump sums. The value varies widely across tribes. In some, it's below subsistence, and in others, it's tens of thousands of dollars a year. Young people receive their childhood payments in a lump sum when they reach 18. Payments obviously aren't truly universal, but if there's a high Native American population within a reservation, it's likely that almost all members of the community receive payments. There's one research team has been collecting data from the Eastern Cherokee Nation since before the payments started, so there's some quite strong evidence on the effects there, although their payments are below subsistence level. A lot of tribes also use the revenue for substantial investments in health, education, and housing. So often it's not possible to tell whether any effects are due to the individual payments or to improved services. Obviously, there have been some recent pilot studies. The Ontario Basic Income Pilot began in 2018. It was a negative income tax scheme, very similar to the 5 North American studies in the 70s. It was an unconditional payment which covers subsistence. Actually, it was quite a lot more generous than the existing social assistance benefits, but it was withdrawn in line with earnings. Following a change of provincial government, the pilot was ended 2 years earlier than planned. There is rich evidence available from in-depth interviews with participants, but unfortunately no data from surveys which compare the experiences of people who received payments with people who didn't. The Stockton Economic Empowerment Demonstration began in 2019. I had a sample of 125 Stockton residents who were given $500 a month for 24 months. A summary of the preliminary findings was released in March. Payments were unconditional and the value didn't change, but they were below subsistence level and clearly not universal or permanent. Although the study has a strong design, the sample is so small, it's difficult to place much weight on the findings. And finally, I won't attempt to say that in Dutch. What Works was a small Dutch study in Utrecht, which compared a range of different approaches to encouraging people who were on social assistance to find work. One small group received standard benefits with no conditions. So far, I've only been able to find a brief summary in English. Again, the sample is so small, it's not possible to have much confidence in the findings, though it seems that there may be some useful in-depth interview data. The Finnish pilot is excluded from this because, as I said, many of the people in the pilot were still subject to work-related conditions, so it doesn't meet the essential criterion for the review of unconditional payments. Looking now at some of the results that we found, the findings of these studies drawn together. Overall, there don't seem to be large effects on employment. Male breadwinners in the NIT studies reduced their total hours by a small amount, but this was mostly due to longer gaps between jobs, apparently finding better work. A recent analysis of data from Dauphin did find a larger drop in employment compared to the scattered site. There are also small reductions in hours worked for men in Alaska. But single men increased their hours worked immediately after payments are received because increased consumption leads to higher demand for workers. Some studies reported no effect on employment. Married mothers had larger reductions in the NIT studies, which they apparently used to spend more time in the home. Women with young children in Alaska also reduced their working hours in the short term. Earlier analyses of NIT data seem to show that single parents worked quite a lot less, but a recent reanalysis suggests that in fact there was no effect in the Denver study and a larger increase in the Canadian study. Women in Iran increased their hours worked, and in some studies, small business owners also increased their working hours, possibly because they were in a position to invest in the business. In-depth interview evidence from Dauphin suggested that the payments allowed people to respond flexibly to job loss, new caring responsibilities, and their own health problems, knowing that they had a secure income floor. Importantly, they valued the fact that they could stay in work and still receive payments. A new analysis of data from that site suggests that where people reported working less, women were more likely to say it was due to working conditions, family reasons, or for education. It was also reported that it was much less stigmatized than standard benefits at the time. Effects on health, we find a slightly mixed picture. There are strong positive impacts on some outcomes. There was a large reduction in low birth weight and in in Alaska and in one NIT study. Infant obesity also reduced by quite a large amount in Alaska, and there were improvements in nutrition in an NIT study and in Iran. There were large improvements in a range of adolescent mental health outcomes amongst the Eastern Cherokee Nation, as well as improvements in substance use for teenagers. And there was also an increase in expected lifespan among some adults. People who received OBIP payments through the recent Canadian pilot reported reduced stress, improved nutrition, and ability to afford medication. In the studies which compared outcomes between different groups, almost all of the positive effects were concentrated among people who were on low incomes or in poverty when the study began. A number of studies also report no effects on a range of health outcomes. Chronic health conditions and health service use did not change in several NIT studies. Children's health outcomes such as accidents, asthma, and allergies did not improve in the Eastern Cherokee Nation, and there was no effect on birth weight in the Canadian saturated site at Dauphin. Some negative effects were also found. In Alaska and the Eastern Cherokee Nation, mortality increases substantially after receipt of payments, which appears to be largely driven by increased substance use. However, both of these involve large lump sum payments. Other large payments, such as salaries and social security, are known to have similar effects. There are some reports of increased substance use and worse diet from in-depth interviews in other casino dividend studies. And finally, it was reported, had previously in an earlier study, that hospital admissions reduced by 8.5% in the Dauphin saturated site. The data have recently been reanalyzed, and it now appears that admissions actually increased by about 5% during the study period. Increased use of health services is not necessarily a bad outcome, but it is quite different from the previous findings. Looking at effects on education and some social outcomes, A number of studies report effects on educational outcomes for young adults or children, and several of the NIT studies found large reductions in the amount of paid work that adolescents did, and this seemed to be more or less exactly replaced by spending more time in education, maybe because the family no longer needed their income. Some studies report positive effects on being enrolled in or completing high school. For the Eastern Cherokee Nation, the time spent in school increased by up to a year for children who were poor at baseline. Teenagers in Dauphin were also more likely to progress to grade 11 of high school. Effects on educational performance were more mixed, though. In some studies, there were strong effects, and in others, there was no effect reported at all. There were some reports of young people in casino dividend studies who weren't in education or training, but these were small studies, and the young people also received very large lump sums at the age of 18, which might explain these effects. However, an Alaskan study found no improvement in high school completion, and another found that fewer people completed undergraduate degrees. Effects on family relations were also reported by some studies. There was no effect on divorce rates in the NIT studies or in the Eastern Cherokee Nation, where there were large positive effects on parent-child relationships. And this possibly explains the improved child mental health that was seen there. There were reductions in some forms of marital conflict in the Minkum NIT study in Canada. And low-income mothers of young children in Alaska spend more time at home. Also, OBIC participants report spending more time with family and friends. There's some evidence of reduced property crime in Alaska, although substance use-related crime increases immediately after payments are made. There was a large reduction in crime in Dauphin, possibly due to a decrease in domestic violence. There was also a large reduction in arrests for Eastern Cherokee adolescents and also for their parents. Finally, Eastern Cherokee children who were in poverty before receiving payments were much more likely to vote as adults, possibly due to the effect of spending longer in education. So, as I discussed earlier, some of the most unpredictable and hardest to measure effects of a basic income are long-term, macro-level and spillover effects. With all the caveats about Alaska, fluctuating payments below subsistence level, made once a year and not funded by taxation, is still the source of the most credible evidence on these effects because it's been paid to an entire state population for nearly 40 years. And there are many studies with strong designs looking at a wide range of outcomes. So what we can glean from the Alaskan evidence in terms of spillover effects, the effect on male employment is thought to be small, with small increases at times, purely because people buy a lot of stuff when they receive the APF, which increases demand for workers. At the same time, low-income mothers of young children work less and spend more time with their kids. This may explain the large decrease in infant obesity, which is predicted to result in large savings in cost of health services over the next few decades. There's a modest increase in inflation, while early positive effects on small business startups faded quite quickly. There's also an effect on income equality, which actually increases because people who are wealthier are in a position to invest the basic income or the APF payments into productive assets, which then generate more income for them. Other evidence for spillover and higher level effects includes in Dauphin, there were large crime reductions compared to the sites where the samples were scattered. This may be due to reduced marital conflict and domestic violence. There's evidence that when teens chose to spend longer in education, it was partly due to knowing that their friends were also choosing to do the same thing. And there was a decrease in the number of applicants for jobs, which seems to have caused employers to increase wages. As we just saw in the Native American, in the Eastern Cherokee study, spending longer in education appears to have resulted in higher voting levels. And also in the Eastern Cherokee Nation, positive effects on mental health, education, and offending seem to have grown stronger over time, suggesting that improvements are cumulative. So the long-term implications of impacts, such as spending longer in education or reductions in low birth weight, could be quite profound at both an individual and a societal level. There's evidence that improvements in both of these outcomes can lead to increased income, better midlife cognitive ability, reduced mortality, and increased economic productivity. So what do we know about the effects of a basic income? we can have a fair degree of certainty that receiving unconditional payments doesn't seem to make people work much less. And if they do, it's often so they can increase the amount of time they spend on other activities, such as caring. Again, the evidence is from scenarios that don't replicate a full BI, so it's difficult to know whether the effects would be exactly the same. We have evidence of some strong positive impacts on health and education, but quite a lot of studies find no effects, and in some cases, effects are negative. Where findings are inconsistent across studies, it's harder to know what would happen if the policy was implemented in a different location. There's fairly consistent evidence that receiving payments has positive effects on family relations. Given that there has not been a study of a policy or programme that replicates all of the conditions of a basic income, we still don't know very much about community level, macroeconomic or longer term effects. Positive effects on so-called disadvantaged groups are often strongest or only present, even in studies where everyone receives payments. For me, this begs the question, what is the added benefit of paying everyone? The arguments in favour of paying everyone tend to be ethical, but they still concern effects on things like social solidarity and equality. As I just mentioned, in Alaska, there's evidence that income inequality has increased as a result of the payments. Other things like social solidarity, I'm not aware of any studies that have investigated that, but it would be quite possible to do that in a large study. We know very little about the economic effects of potential cost savings if use of services such as health, social work, and the criminal justice system were to decrease. There's also little evidence for spillover or long-term effects of increased education, reduced low birth weight, etc. As I said, it does seem that staying in education has increased voting in one study, and reduced infant obesity in Alaska is expected to lead to substantial savings on health services. But those are, it's not a large body of evidence. These are just still quite tentative findings. And finally, as I said, we don't know how effects might differ if different funding mechanisms were in place. So in short, much is very unpredictable, and there is a possibility of unintended consequences. So as I mentioned earlier, there are many US pilots either ongoing or in the pipeline. Unfortunately, most, if not all of these, are too small to tell us very much, use scattered samples, target vulnerable groups, and/or do not reach subsistence level. Cities and charities are spending vast sums of money on these, and if only it were in my control, I would have asked them all to get together and pool the money so that they could do one large study, came closer to meeting the criteria. As we know from the feasibility group talk this morning, much work has been done in establishing the feasibility of a Scottish pilot, but without cooperation from the Westminster government, it's not possible to make the changes to people's benefits that would be required. Ireland looks like it actually may be very close to a basic income pilot, but this one again is only going to be targeted at artists, so they're not representative of the wider population, and the payments will be withdrawn over a certain income threshold. Obviously, the proposed Welsh pilot has been much in the news recently, and the proposal is for a small study targeting care leavers. No doubt it would be very helpful for care leavers to receive additional cash, and perhaps that is a study that could be conducted within the terms of the Welsh devolution settlement. Unfortunately, it wouldn't be a test of basic income. There is already a huge amount of evidence on the effects of payments targeted at disadvantaged groups, and an exercise to synthesize all of that evidence would probably be more helpful in conducting another small study of a similar policy. It's been interesting to see that a lot of civil society and basic income advocacy organisations have responded to the proposals by pushing for a geographical sample so that the study is representative and it's possible to measure community level effects. This suggests that the debate in the UK is actually quite different from what's happening in the US, because the studies, as I've said, they are still very small and scattered samples. Unfortunately, the proposed alternative study design still has some problems. Because Wales is obviously a rather small country, there are a limited number of communities to choose from, and identifying one or more which is representative of Wales as a whole would be rather difficult. If there are only a few communities, it's also difficult to tell whether any differences are due to the payments rather than another change which only affects one of the communities, such as building a new factory or something similar. There are other study designs that could allow for only one or two communities to receive payments and still identify whether any changes are due to the basic income. A synthetic control study could draw data from a number of matched communities across the UK and merge this to create a synthesized comparison community. This would use data on outcomes that are routinely collected by central and local government, including employment, health, education, crime, and a range of other outcomes, which also has the added benefit of reducing the cost of data collection. This could be supplemented by a small survey and in-depth interviews in the basic income community. It would allow for the measurement of community level effects, although it still wouldn't measure the macro level effects of a basic income in an entire country. However, this study design may also still be impossible to do within the existing devolution agreements. There are also approaches to measuring the effects of implementing a basic income at the level of an entire nation and changing the tax system, involving dynamic simulation modeling. And these can simulate the spillover and macroeconomic effects of implementing a real world basic income. So in summary, there is much that we don't know about the effects of basic income. It's very difficult to evaluate, and there may be unintended consequences. However, there are approaches to trying to get better estimates of the potential effects, and these should be explored going forward in order to investigate the potential effects of implementing basic income. So, thank you.
Thank you very much for that. I think we'll maybe take some questions just now. We've got a couple of questions in the questions and answers box on Hoover, so I'll maybe take a few from there, and if anyone wants to actually unmute themselves and ask a question as well, I'm sure that would be fine. So I'm just going to have a look at we've got 4 votes on a question, so I'm just going to go ahead and read that to start with, and we'll maybe see if the discussion kind of results from that. So the first question we've got is, why do we have to research the effects of a basic income when we already know the effects of income? What leads us to believe that it matters how one received the income when it comes to outcomes? So I guess this is maybe a question about, you know, how do we know that these effects are specific to a basic income? Does that make sense, that question, Marcia? Can you speak to that?
Yeah, absolutely. I hope some of the content of the talk I've given has addressed some of those issues. We do have evidence from studies of giving income to people who are generally people who are on low incomes, unemployed, in poverty, or vulnerable in some other way. Actually, the evidence isn't as unequivocal as you might imagine. There have been a couple of big systematic reviews done recently that find mixed effects of, for instance, reform to social security systems, but that giving payments to small groups of people who are particularly disadvantaged doesn't replicate the effects of a full basic income implemented at a societal level. We don't know what would happen if we gave it to everybody. And again, the evidence from a lot of the basic income studies is that most of the benefit is seen by people who are in those groups, people who are poor or unemployed or vulnerable in some other way. So it still begs the question, even if the evidence showed that there were unequivocally good effects of that, it would still, for me, beg the question of what is the added benefit of providing it to everybody.
Hopefully, I'm looking at who asked that question. It was Daryl Finkton, who I'm not entirely sure is in the participants, but hopefully that answered their question, and maybe they'll be able to see that on the recording, or if they are in the room and I can't see them, if they want to unmute themselves and let us know if that did answer the question. But if not, I'll have a look at what other questions we have and we can move on to another one. So we have another question here from Andy Abbott, who I believe is in here. So has universal basic income's impact on recipients' desire / ability to get involved in creative or cultural activity and or undertake creative artistic labour been monitored or evaluated in any pilot programmes to date? It would be really handy for making the creative case for universal basic income to organisations like Arts Council England.
I think we've been asked to stop recording while we take the discussions.
Is that right?
That was my understanding. I've just seen something come through from the other session as well saying that.
Okay, apologies everyone. We will stop the recording again.
unless people are all happy for it to keep going. But
well, I don't mind.
If anybody wants it, I'm happy about being recorded. Please just let us know in the next minute and we'll start it again. Otherwise, we'll start it.
Oops. Should I wait a minute then to respond, or?
Just put it on the chat box if anybody's unhappy, and if not, we'll just keep going.
Okay. So hopefully that's fine. We have
started again then.
That question about kind of the effects in terms of people engaging in creative activities, and so I don't know if you'd like to answer that, Marcia, and I think Andy Abbott is in here, so if you'd like to respond to that as well after you've had a
I'm not aware of any studies that have collected data sort of directly on that. There is evidence from the Dauphin study about the kinds of activities that people engaged in if they did reduce the amount that they worked, but it's slightly difficult to interpret because they don't actually tell you how many people reduced the amount that they worked. They just tell you what the people who did reduce the amount of work they did said they were doing instead of working. As I said, all those effects were kind of concentrated on among women, and the main reasons were to do with not being happy with their existing working conditions, needing to spend time with family, presumably caring responsibilities, and returning to education. There probably is qualitative evidence from the recent Canadian pilot. Now I think about it, but I haven't extracted the information from the data from those studies very thoroughly yet. So yes, but I think people do talk about being able to engage in alternative types of activities. You need to go back and look at the study to confirm whether that involved creative pursuits. As I said, the Irish pilot, which seems like the most plausible that it's going to go ahead because there's political buy-in and there's no issue about funding or devolution settlements or anything like that, will be focused on artists specifically. So that is going to be interesting in those specific terms, but as I said, slightly unfortunate from my perspective because artists aren't representative of where they're already engaged in creative activities. We know that they're creative. It's kind of what would happen to people who would like to do that but can't because of their working conditions, if that makes sense. Does that answer the question?
Yeah, that's great, Marcia, thank you. I was just kind of, I mean, I'm interested in it because we run a UBI Lab Arts subsection of the UBI Lab network, and kind of this question around, not necessarily, universal basic income that is for everyone, what would the overall effect on the arts be? I think really fits quite neatly with the rhetoric of the Arts Council at the moment around their let's create strategy and kind of, how do we diversify the voices that are involved in artistic activity, both in terms of their production and kind of who's going to stuff as well. And it would be really nice to be able to get universal basic income on the sort of agenda in that sort of conversation as well. But I'm, as you say, I'm not really aware of any kind of really specific kind of evaluation of, well, more people did art with their spare time or felt that they could be creative with their time. But the anecdotal evidence, would come from, the period in the 80s where people were able to be on the dole easily and kind of, and there was a lot of good art and music that came, but it would be nice to be able to kind of get something more specific. But it's really...
that there was a scheme in Holland, I think in the 80s, where they made payments to artists. I don't know if there's any evidence from that. I would love to find out if anybody ever evaluated it in any way. But and as you say, it was sort of a de facto at one point in the UK. But as I said, the kind of all these new studies I haven't extracted in full yet. So there may be from some of the qualitative studies, there might be some evidence on that. Hopefully we'll get the opportunity to extract the data properly soon.
It'd be great. And I think, I mean, the other point I'd probably make on that, which we might explore in some of the sessions we're doing later, is there'd be so many artists who would love to be part of these pilot schemes as evaluators. You know, there's artists that work in that research way, or could be sort of using that as a sort of, an opportunity to sort of test it themselves in these pilots. That I think it would be great to get some sort of embedded artistic researcher in these kind of pilots when they happen as well. But yeah, thanks for that, Marcia. That's great, and thanks for a really good talk as well.
Thank you.
I'm just looking through the questions again, and I'm seeing a question, and I'm sorry to bring up the coronavirus, but there is a question: any lessons to investigate regarding basic income about COVID payments programs such as CERB, C-E-R-B in Canada? So I don't know if you maybe can speak about that, or in terms of, in general, if there's sort of any evidence that is coming out or planning to be investigated in terms of COVID payments.
Yeah, that's a really good question. I think there probably will be, certainly in the States, there will be a whole bunch of economic researchers using econometric study designs to evaluate the effects of payments there. That immediately when the COVID crisis started, federal unemployment benefits were set at $600 a week. And that was in addition to state unemployment benefits. So actually a lot of people were quite a lot better off during that period if they were able to access benefits. I've seen one study that showed business startup has increased quite dramatically over the course of the pandemic, which is quite, given the conditions, kind of quite striking. I don't know anything about the Canadian, or very much about the Canadian study, but as I said, I imagine there will be quite a lot of researchers who are investigating those effects using kind of particular types of study design. My feeling was that this was another situation where we know that inequalities increased massively as a result of the pandemic, and people who were already doing okay did really well and mostly were able to save money, whereas living costs increased for people who were keeping us all alive, basically. The folk who are able to work from home were being kept alive by the essential workers, and it's quite likely in that scenario that people who've already got money and already saving would save even more. And as I said, that appears in Alaska that's actually resulted in an increase in income inequality. So to me, given that the pandemic has resulted in a massive increase in inequality already, doing something that risks making that even bigger doesn't seem like a good idea. Personally, I think payments should be targeted at the people who, as I said, kept us all alive. But I hope that answers the question. So that was a bit of a rant.
No, that's quite all right. I know it's probably a very pertinent question at the moment. I'm just thinking, I know, would anyone like to come in on that, on the sort of coronavirus and payments, or shall I move on to another question, or would anyone that's in the call just now like to ask any questions that are related to that? Because I know it's obviously a very relevant one. Not seeing any hands or anything. So I'll maybe just go back and have a look at some of the questions on Hoover. And we have a question here that's, is there research on how much universal basic income would grow the economy through increased capacity utilization? Also on what the effect on wage levels would be. How much would wages increase due to increased aggregate demand and increased labour demand? I'm not 100% sure what that means myself, but hopefully that makes some sense to you.
Yeah, I'm not sure about the increased capacity utilization, but I think I can answer the other parts to some extent. Again, we don't really know what the effect would be at a macro level, given a funding mechanism that replicates what our actual basic income would be in practice. But the evidence from Alaska, I'm not sure about evidence on wages from Alaska, frustratingly, and I'm sure it would be possible to do that, a study of that. But there do appear to be increases in employment due to increased consumption, which increases demand for labour, particularly kind of concentrated around a period when people receive payments. There is some evidence of kind of modest increases in inflation, and evidence from, I mean, it's a small study and it's a long time ago, but in Dauphin, wages increased by quite a lot. I think it was 66 cents an hour. I'm not sure if that's equivalized to today's values or not, but and that appears to be because just fewer people applied for the jobs that were available, and because they didn't need to, and the employers had to increase wages as a result to try to make their positions more attractive. The increased capacity utilization, as I said, I'm not entirely sure what that means, but I think it's again something that could possibly be looked at using data from Alaska.
Yeah, I'm aware that the person that asked that question is in the call. I don't know if they would like to, if that answers the question, or if they'd like to come back on that at all.
Yes, that was a very good answer. In regards to capacity utilization, it's a measure that's put out by the Federal Reserve, and it tries to estimate, for example, within industry, what is the total capacity of how much could be produced, and how much is actually being produced based on demand, as a percentage of the potential.
Again, not 100% sure I'm sort of grasping that right now, but I think another thing that we know increases productivity is better job fit. And if people were able to choose to exercise more choice about the types of jobs that they did and do jobs that that were suited to their kind of interests and skills and what have you, it's quite possible that would increase gross productivity. And that may relate to the point about capacity utilization.
Thank you very much.
I think I saw that. Was that you, Mike, with your hand up just there? Do you want to come in on that or on another point?
No, just on that. I answered Eddie in the chat. A complementary piece of work with the feasibility study was economic modelling at macro and micro level of the Scottish proposed pilot, or in fact having a UBI across Scotland. It's actually by Peter from Strathclyde University, and I've put a link in there which you can have a look at. It has to make assumptions and so on, but it does cover quite a few of the issues you're talking about there.
And then it sort of predicts that basic income would result in reduced overall productivity, if I remember correctly.
Thank you. I'm actually on Zoom directly, and I can't see the chat, but I may have to contact you to ask you for that link. Thank you.
I believe it should be in the chat on the Hoover, is that right, Mike? Yeah, so it should be on there, and you should be able to see that after the session has ended, I believe. So hopefully you can find that. And yeah, I'm just thinking, does anyone...
Sorry, I put it on Twitter as well, if you have a look on there. Yeah.
Excellent. Does anyone on the call want to come in on anything that, or ask another question directly? Or shall I go and have a look again at the Hoover and see if we have any more questions?
And
Can I just ask? Sorry.
Yeah, go for it.
Go on.
Can I please ask if you can attach the research on the Alaskan pilot?
Well, the Alaskan, that's not a pilot, that's a policy that's been in place for 40 years. And there are, I think, I can't remember how many, but over 20 studies have been done of, is it that much? Sorry, I can't remember off the top of my head. A lot of studies have been done of Alaska. They tend not to be published in journals because econometrics people, for some reason, tend to publish things as working papers, so they can be quite difficult to find. But the ones that were included in the original review are all referenced in that review. So I can send you a link to that. And I could send you links to the studies that have been published since then, if that would be helpful.
Yes, thank you. We're looking for research that particularly pertains to domestic violence and a reduction in domestic violence brought by an income grant. If you have access to that, that would be great. Thank you.
Sure, that there is some evidence on that from DOFAN, but there's nothing on that from Alaska. So I can send you the paper from DOFAN that looks at crime and sort of marital relations broadly. I think that might be two separate studies, but they're linked. So yeah, I'll post them in Hoover at some point. I spotted a question in the chat about middle income and low income countries. There have been quite a few systematic reviews of varying degrees of quality, I guess you could say. A lot of the programs in low and middle income countries have been conditional cash transfers, so the evidence is a bit different. And although a lot of the time the conditions aren't to do with employment or to do with other behavioural things like getting your kids vaccinated or taking them to school or whatever. But yeah, there are a couple of reviews of varying kinds of the evidence from low and middle income countries. One thing they tend to conclude is that for some reason there's a particular fear when it comes to low and middle income countries that people will just go out and spend all the money on alcohol and tobacco, but there's no evidence for that from any of the studies that I know of. In fact, if anything, it's the opposite. So
I can see that, is it Louisa Alvarez has a hand up if you would like to ask a question, and then there's something else in the Hoover questions I'd like to go to as well. So go for it. Is that a hand up? Or you can maybe post a question in the chat if that's better. I don't think we can, you seem to be unmuted, but we can't hear you, so I'll maybe just move on to Hoover, and if you can pop it in the chat or anywhere, then we can try and get to you. So I saw a question that's just on Hoover there that I'd like to ask, and I hope it's not maybe overstepping your boundary as a researcher, but there's a question here that says, in your experience, do basic income pilots contribute positively to the political and social feasibility of the idea of universal basic income as a whole? In other words, do pilots gain support for universal basic income? Don't know if you'd like to answer that.
You might be better pleased to answer that, Jack, I think. I know that, but it's obviously going back an awful long time, but the North American NIT studies were really, really controversial. And actually, I mean, some of the people ended up being harassed, and you know, there was lots of horrible negative media coverage, and various politicians started demanding data before the program, the studies were finished and all that kind of stuff. So I think you could possibly infer from that they didn't, you know, didn't sort of increase the popularity of something a bit like a basic income. Can't think of examples from any other more recent studies, although as Wendy kind of alluded to a couple of times in the morning, the reporting just is bizarre. Like the number of times I've read that there has been a pilot in Scotland, and that there is a basic income in Sweden. That's one that people are always telling me, there's a basic income in Sweden, which I think comes from there having been a pilot in Finland. But yeah, so a lot of the reporting is just so distorted that, yeah, it's pretty hard to tell. I think you would need to do a kind of quite a specific study looking at that particular issue to investigate it more. Do you know anything about that kind of thing, Jack, in terms of?
I mean, it's certainly a very interesting subject, and I know that I think it's, you know, these pilots can be used to gain political support for them, but it's, you know, that's very much in the hands of the advocates that are doing it. I know that with one of the US pilots that's I can't remember what it's exactly called. It's the mayors for minimum income in the US, and I know that a lot of those things, despite being small studies, they're very good at displaying the evidence in very good ways and making it seem very positive. So whether that can lead to support for these kind of interventions, it's how you go about communicating that. Certainly.
Yeah. But I did actually in the original version of the review that was done for What Works Scotland and published in 2018, I think. I did a lot on implementation and context and what have you. And that was one of the kind of key things, was framing is going to be crucial and has to actually really be thought about. I think, again, Wendy alluded to that this morning. Would have to be thought about really, really carefully if you want to do a basic income, because obviously as soon as it was started being discussed in Scotland, the Tories and some of the press were on it, saying, giving money for nothing, scroungers, etc., etc. So,
yeah, and I think, as you say, that there would need to be a specific study on, whether these pilots have led to increased support and that is a study which I'm not sure exists myself, but would certainly be interesting for maybe anyone on this call that's doing a master's or a dissertation for the undergraduate. That's something to be investigated. I can't remember it exactly, but I know when I was doing my master's dissertation, there is I think in the basic income handbook, there is a chapter on sort of communication, and there's a chapter on sort of the different framings of it. So, whether it's framed in terms of environmental support, in terms of whether it's because of automation and things like that. And there's a chapter on that and how the different ways that it's framed. And maybe there's something in that about whether that leads to increased or decreased support. So I think if anyone wants to check out
one thing we
that
do
might be a
know
good idea.
Is, sorry to interrupt, but one thing we do know is the Alaska Permanent Fund is massively popular, and any politician who attempts to mess with it is just absolutely, figuratively hung, drawn and quartered, basically, political suicide. And that's despite the fact that I think Alaska is one of the most Republican states. I may have got that wrong, but it seems to ring a vague bell. But it's framed to them because it's resources, it's framed to them as something that belongs to everybody and they hold it in common, and therefore everybody has a right to a share of it. And I think there's probably something in that for, particularly if anything was funded through taxation on resources or sort of sovereign wealth fund or anything like that. It would be, well, this belongs to everybody, it's ours type of thing.
But yeah, that's certainly a good question to kind of fit in with the theme of idea to reality. Do these pilots actually increase support? And I'm aware that we need to end the session at 2:45. So just on that point, does anyone else have any other questions that they'd like to ask before we end the session? Or shall I quickly have a look at Hoover? It'd be good to kind of keep on the subject of this, idea to reality to end. So if anyone else has any questions on that, or anyone would like to say anything in general.
I'm actually curious about one of the questions, not quite sure what it means, but is it changed tax system more appropriate way of looking at a tax financed UBI?
I asked that question, and you said that you have you needed a tax increase of 5-8%, but in my opinion, we have to change the tax systems. So because basic income will change the economic levels in a way. And therefore, you can just put it into an ordinary tax system. So, and we cannot sell that political if you want a tax rate of 5 to 8% just to get the basic income. But in this session about pilots, there's also interesting to see if you're wanting a big geographic pilot, you probably have to put it into a realistic tax system. Thank you.
Yeah, I mean that was I was referring to a modelling study that the Scottish Feasibility Group commissioned, and they were asked to do the modelling within the context of the existing tax system, and that's what they found out that would, for a kind of fairly low level basic income, it would require tax increases of 5% to 8% across the tax bands. But I agree that a pilot, or a kind of an accurate assessment of the effects of basic income really needs to be in the context of a realistic funding scenario, which is one of the issues again with the Scottish pilot, is that they wouldn't be able to touch the tax system. So it really wouldn't replicate, the actual kind of final shape of the policy.
Before we finish, Jack, can I just come in here as the moderator on this? As you know, we stopped the recording and we restarted it on the questions, and there's been quite a bit of stuff bouncing around in the background. We've been asked to stop, and we've been told that we need to get sign-off forms from everybody on record, so that the session that's been recorded since, unfortunately, we're going to have to drop. It's not our choice to do that, but this is the discussions we're going to have to actually take off the recording. Let's just let everybody know that, and apologies for that, but that's the way we have to do it. Okay. Anyway, I'd say thanks for also a really interesting session, Marcia.
Thank you.
Yeah, thanks everyone. And yeah, we might have to cut off that bit, but that's been a really interesting session. Thank you, especially to Marcia for giving that talk, and thank you all for putting your questions in Hoover. I know it might be a new platform for everyone, but it seems to have worked. So hopefully we can enjoy the rest of the Congress in the same way. Thank you all for coming.
Thanks very much, everybody.
Cheers.